There's a common misconception that because a drug is over the counter instead of prescription that is somehow safer. This really isn't the case. These drugs that have been made over the counter were at one time prescription drugs because of their safety issues. And the drugs have not changed. They haven't been somehow magically been turned into some safe type of drug. These drugs are the same exact dangerous drugs that were once prescription. One of the best examples of this is the drug ibuprofen, commonly sold under the names of Motrin, Nuprin, Advil. During clinical trials of ibuprofen, 24 people died of chemical-induced hepatitis from the drug. Now, the reason this occurs is because these drugs can cut off the blood supply to the organs. To really explain this, I need to go back into the chemistry of how the drug works. We have hormones that are called prostaglandins. Now, there's different types of prostaglandins in the body that have different functions, such as maintaining our blood pressure, formation of our stomach acid, but we also have what's known as inflammatory prostaglandins. Now, these inflammatory prostaglandins play a very, very important role for the body. Let's say if you injure a part of the body, let's say the wrist, you sprain your wrist. What will happen is the inflammatory prostaglandins open up the blood vessels to that area to help bring oxygen and nutrients in to speed the healing process. This is something that we want. The problem is when the blood vessels are expanded for long periods of time, they become permeable and they leak fluids in the surrounding tissue, and therefore we start getting the pain and inflammation. So these NSAIDs, non-steroidal anti-inflammatory drugs such as ibuprofen, are used to constrict the blood vessels to keep them from leaking. But if somebody has a problem with poor perfusion or blood flow to the organs, let's say people with diabetes, Raynaud's syndrome, Raynaud's disease, if they have congestive heart failure, if they get born with narrow arteries, anything like this where they've got poor circulation and therefore low circulation to the organs, the drugs, the NSAIDs, or non-steroidal anti-inflammatory drugs I was referring to, can cause the blood vessels to contract down even further, cutting off the blood supply to the organs. Therefore, some of the different known side effects of these NSAIDs include hepatitis, kidney failure, loss of vision, aseptic meningitis, tinnitus, which is ringing in the ears. Now, a lot of people have another false assumption that this has to occur with high dose or with long-term use. Again, this is not the case. I personally have met 4 people who have had kidney failure from a single dose, recommended dose of ibuprofen. So don't be fooled into thinking that you have to overdose or take this for long periods of time. The people at most risk, again, are going to be people with congestive heart failure and diabetics who are more likely to actually be using the drugs. So I just want to warn people, be very, very careful about using NSAIDs.